Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
There are two main side effects of CAR T-cell therapy that are different than really any other therapy we had given before. The first side effect is called cytokine release syndrome. We abbreviate it CRS, so cytokine release syndrome. What happens is these T-cells are really good. Within about 24 to 48 hours, they go straight to the cancer and start killing. Now, when they kill these cells, the cells that are dying release lots of inflammatory molecules. On top of that, if you think about these T cells, they're a living drug, which is quite amazing. So once they bind their target, the cancer cell, they will actually start proliferating and make copies. So the actual therapeutic in the body can make copies of itself. It repopulates, which is part of the reason why these work so well. So the problem is they work so well that these copies and proliferation happen very, very rapidly within 24 to 48 hours of administration of the product. And so the patients get a huge inflammatory reaction, much like you have a very bad infection. So patients who get very bad infections, something called sepsis or septic shock, can be in the ICU. A similar phenomenon happens after the CAR Ts, where patients get very high fevers. Again, not from an infection. This is from the cells themselves. So high fevers to 102 to 105 I've seen. They can get low blood pressures. They can get fluid or shortness of breath in the lungs. And, depending on the product used, upwards to 80-90% of patients can get some form of cytokine release syndrome. The majority of patients who get cytokine release syndrome, roughly 2/3 of them, will get just fevers. That's it. It's not pleasant to have a fever, but it's something that we can manage with supportive care. About 20 to 30% of those patients, though, can get more severe cytokine release syndrome, where the fevers are really high or the blood pressure starts dropping. In that case, we have a very, very good medicine. It's called tocilizumab, and it's kind of like it's another antibody. It kind of mops up all those inflammatory cytokines. It clears them from the bloodstream, so the cytokine release syndrome stops. And in many patients, that settles it down. However, a few percent of patients can get quite ill where they need ICU level support. That's why this is a very intensive therapy. Most patients, though, at the appropriate CAR T administrative center, especially a center like ours or our colleagues who have given a lot of these therapies, are very well equipped to deal with the side effects and get the patient safely through their CAR T cell. So that's the main first side effect, cytokine release syndrome. The other main side effect is called ICANS, and it's a long abbreviation, but it's basically a neurotoxicity, syndrome, immune cell effector neurotoxicity syndrome, ICANS. And this typically happens more around 5 to 7 days after infusion of the CAR T cell. And what happens is the patient can get anywhere from just being a little confused or tired, or in worst case scenarios, where you can't wake up the patient, or even having seizures requiring ICU level support. Again, in most patients, it's mild, and it can be a little bit disturbing because the patient's confused and the caregiver's there. But I always reassure my patients, the patients don't remember it, and it resolves in just about everyone. It's not like having a stroke or a permanent side effect. It is unusual, but it resolves in nearly everyone. Again, a small percentage of patients can wind up in the ICU with more severe neurotoxicity. Even in those patients, it does usually resolve, but it can take some time, So that kind of all happens while the patient's in the hospital. Again, some patients just have fevers or have no side effects at all. Other patients require more intensive therapy during their stay after their CAR T cell.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.